What really drives a surgeon? Beyond the insane years of training and the technical skill, what is that core purpose that fuels their work day in and day out? Today, we're going to deconstruct what that calling really looks like, using the words of ENT surgeon Dr. Vega Ware. And it all kicks off with a very personal mission. See? It starts with a motive that is so incredibly personal and relatable. Dr. Vega says, I wanted to be a doctor so that I could help the people that I cared about. This isn't some abstract, lofty ideal. It's a mission that's really grounded in taking care of family, friends, and the community around you. But that brings up a really crucial question, right? Lots of people in medicine want to help. So, what's the next step? What's that specific spark that takes a general desire to care for people and turns it into a surgeon's very hands-on decision to physically intervene and act? Well, that question leads us right into our first section, where we're going to unpack the different layers behind this very personal, very professional calling. Now, this is where it gets really interesting. This slide breaks down two motivations that are distinct but totally connected. On the left, you've got why a doctor, and that's rooted in that personal drive to help the people you love. But then, look to the right, why a surgeon. That reveals a whole other layer, the need to do something practical, something tangible. It's that drive to physically fix a problem and create a change you can actually see and feel. Okay, so once that personal mission is established, how does it actually play out in the exam room? Well, that brings us to maybe the most critical piece of the puzzle, the foundation of trust. This really gets to the absolute heart of the doctor-patient relationship. It's such a simple question, but the answer is, well, it's everything. So how does a surgeon build that essential foundation of patient care? How do they build trust? And the answer, at least from Dr. Vega's point of view, is beautifully simple, but also incredibly profound. She says, learning who they are as a person helps a lot, so really just listening. It's not some complex formula. It all comes down to a fundamental human connection. And this slide just illustrates so perfectly what just listening really means in a clinic. It's about digging deeper to understand why a patient came to see you. It's about piecing together the whole story of what brought them to this exact moment. And crucially, it's about seeing them as a complete person, not just a list of symptoms. And then being willing to make time for that connection, even if it means the appointment runs a little bit longer. Once that foundation of trust is in place, it really opens the door for the next phase. And that brings us to section 3, making a tangible change. Here, you can really see that practical, satisfying process that Dr. Vega was talking about. It's such a clear and logical journey. You start by meeting the patient and truly listening. From there, you use your expertise to figure out the problem. And then finally, you can offer a concrete way forward, a treatment. So here's a crucial point. We need to think about the word treatment in its broadest sense. It doesn't always mean heading to the operating room. As this slide makes clear, a treatment could be a surgical procedure, sure, but it could also be medication. And sometimes, the most powerful treatment is the act of listening itself, which can bring clarity, relief, and a path forward. And this is the payoff. This is the real reward. That deep professional joy comes from seeing the impact of that whole journey. In her own words, seeing how that can change people's lives has been a really great joy for me. It perfectly connects that initial why with the patient's final outcome. All right, let's zoom out a bit. How does an individual philosophy like this scale up from one person to an entire team? That brings us to our final section, a team's practical promise. Because, a core value this clear and this powerful rarely stays with just one person. That individual philosophy, it naturally spreads outward. It becomes the promise of the entire team. And here is that promise, stated so directly and powerfully. This is their collective mission. What people should know about ENT at Boys Town is that we are a team of people here to make your lives better in a meaningful, practical way. It just perfectly ties together that personal desire to help with the hands-on, tangible action that really defines surgery. So as we wrap this up, we're left with one final thought to kind of chew on. We've seen how listening is a tool for diagnosis, for trust, and even for treatment. But if you take a step back, what is the real human value of just being heard? Not just by a doctor, but in any part of our lives. It's something to think about.